I'm Karen Emmons. I am the faculty lead for the Community Engagement Program for Harvard Catalyst, our Clinical Translational Science Award, or CTSA. And I have the pleasure of introducing our program today on behalf of the 4 Clinical Translational Science Awards in Massachusetts: Boston University, Tufts University, University of Massachusetts Medical School at Worcester, and Harvard University. Each of our programs aims to ensure that the science produced at our institutions benefits all communities and to help ensure that science is conducted so that it's relevant to all. Each of our programs has partnerships with community organizations and community members that advise us on important issues to address, both in our research as well as in our community programs. When we recently asked our community partners what topic we should next focus on for our seminar series for this coming year, we heard loud and clear that housing, homelessness, and health was a #1 priority. As a result of that feedback, and in collaboration with the Mass Public Health Association and the Harvard School Public Health Initiative on Health and Homelessness, we are delighted to kick off our 3-part series entitled Housing, Homelessness, and Health: Evidence, Policy, and Impact. I'm even delighted to see so many participants with us today, and community members, partner organizations, researchers, and scientists. I have to tell you, we were really excited to see the numbers of folks registering today. We had over 850 registrants, so we're so excited about that. We see the numbers ticking up and up on our participants, and we hope that each and every one who's here with us today will find some information useful and contribute as part of the discussion. We think this is such an important topic. Today's session, What Do We Know About Housing and Health, is designed to provide some background on the current state of science, service provision, and policy. Our second session will focus on our grassroots perspectives on solutions to our housing and homelessness crisis. Our final session will focus on the role of health systems in addressing the crisis. I'd like to just, before I introduce everybody and tell you how this is going to run today, I'd like to provide just one sort of thought or idea that we hope everybody will be, perspective that everybody will think about throughout today's session and the sessions to come. And that is, what can each of us do in every capacity that we have as a community member, as a scientist, as a worker, a voter, a citizen? What can we do to help move the scientific evidence that we have, the ideas that we have for addressing these problems forward? Today, we have 3 outstanding speakers representing, as I said, research, housing services, and policy. Each will speak for about 12 minutes, and then after all 3 are done, we're going to have Q&A. So we'll invite you all to put your any questions you have in the Q&A function, and we'll do our best to get to all of them. So with that, I'm going to introduce our first speaker, who is Dr. Tom Byrne, who is an associate professor at the Boston University School of Social Work and an investigator at the Department of Veterans Affairs Center for Healthcare Outcomes and Implementation Research and the National Center on Homelessness Among Veterans. He's a national expert in the causes and consequences of homelessness and housing security. With that, Tom, I'm going to let you kick it off.
Okay, great. Hopefully folks can see my slide. Maybe if one of my co-panelists could give me a thumbs up. Okay, great. So thanks for having me here today. My presentation today is really just about the nexus of housing and health. And my goal is just to provide a quick crash course, so to speak, on the nature of and evidence about the relationship between housing and health. So it's meant sort of hopefully set a foundation for today's conversation. And there's lots more to say about many of the topics that I'll touch on, and hopefully we'll have a chance to discuss those a little bit more during the Q&A or in future sessions hosted by the CTSA. So with that in mind, my more specific goal with today's presentation is really to make the following main points. First, housing is a key social determinant of health, and I'll talk about the various ways in which housing can impact health outcomes. Second, I'm going to focus in on what the research says about the nature of the relationship between housing instability and housing affordability and how they affect health, as that's where a lot of my research is focused. Third, I'm going to talk about kind of the growing interrelated problems of housing affordability and instability that we have both nationally and here in Massachusetts as well. And finally, I'll try and make the case that an expansion of low-income housing assistance programs has a real potential not only to address these problems of housing instability and affordability, but to drive improvements in population health. So I want to start first by sort of sharing just by sort of, again, starting with this first point that housing is a widely recognized social determinant of health. And I want to start by summarizing a theoretical model which details the mechanisms by which housing is believed or by which housing can affect health. And there's really four main pathways, widely accepted pathways by which housing can impact health. And I'm going to use terminology from a really excellent paper by Carolyn Swope and Diana Hernandez to describe these pathways. And they describe these pathways as the four C's. And the first C is the condition or the quality of housing, which can impact health outcomes. So, for example, we're talking about things here like the presence of lead paint or mold in housing, which can negatively impact health outcomes, or the presence of other dangerous physical conditions like exposed wiring or loose stair treads that can lead to accident and injuries. And the second C is the consistency or stability of housing. And the idea here is that different forms of housing instability, like homelessness or eviction or doubling up or frequent moves, can increase the risk for a wide array of health outcomes. And conversely, that stable housing can promote good health outcomes. And the third C is the cost or affordability of housing. With respect to cost, housing and affordability can negatively impact health outcomes by restricting the amount of money that households might otherwise spend on non-housing goods and services that are health promoting. Low-income households in particular spend a large proportion of their income on housing, and that forces really difficult trade-offs between rent and other needs like food, medicine, or needed healthcare. And finally, the fourth C is context, or the physical and social characteristics of the area in which housing is located. Any given housing unit is located in a particular neighborhood context, and features of that neighborhood can impact health. For instance, aspects of the built environment, like the availability of parks or green space, might be associated with children's levels of physical activity and their mental health and their overall health and well-being. And while we could say a lot about each of these pathways by which housing affects health, I want to focus in really quickly on two pathways where much of my own work is focused, and that's on housing instability and housing affordability. So when we're talking about housing instability, we're often talking about homelessness, as that's the most acute form of housing instability. And the evidence is really overwhelming that homelessness is bad for one's health. There's a wide body of research linking homelessness to a whole host of adverse health outcomes, including increased risk of mortality, earlier onset of geriatric conditions, increased risk of victimization of violent crimes, unintentional injuries, and higher and more costly use of acute health services. And on the flip side, there's evidence that housing interventions that are targeted specifically at people who are experiencing homelessness can improve certain health outcomes. For example, providing people who are chronically homeless with permanent supportive housing reduces their utilization of acute health services, things like emergency departments and inpatient hospitalization stays. And I'm part of a team doing research at the VA that's focused on a housing program specifically for veterans that, among other things, provides temporary financial assistance for things like security deposits, move-in costs, temporary rental assistance. And what we've found in studying that program is that the receipt of temporary financial assistance is linked with reduced healthcare costs, as well as reduced risk of mortality and suicidal ideation. And there's also evidence linking housing affordability and health. Evidence shows that households who are cost burdened, that is, households that are paying more than 30% of their income towards rent, have greater cost-related barriers to healthcare access. And more significant housing cost burdens are also linked to other adverse health outcomes, adverse mental health, to child development, and to overall health. And there's been, on the flip side, evidence that the receipt of rental assistance to help households afford housing is linked to improved health outcomes. There's been a flurry of recent studies that leverage new data that link records from the Department of Housing and Urban Development with some large national health surveys to examine the impact of receipt of housing assistance on health. And those studies find that receipt of housing assistance is linked with a number of improved health outcomes, including better food security, better overall health and mental health, and reduced risk of healthcare hardship. That is, a reduced risk of foregoing needed healthcare due to cost. And there's also been some evidence from some work that I did with my colleagues Dan Miller and Maggie Thomas that it's not just the yes/no receipt of housing assistance that matters, it's also the monetary value of housing assistance. So receiving relatively more in dollar terms in rent assistance is linked with reduced risk of healthcare hardship. And when we think about what evidence shows about the relationship between both housing affordability and homelessness and health, we have real reason for concern. It's probably not a surprise to hear for folks on this call that we have a real affordable housing crisis both here in the Boston area and nationwide. And the figures on this slide, which are based on data from the Census Bureau's American Community Survey, try and put some hard numbers on this. So on the left, what you see is inflation-adjusted changes in median rent and median income between 2000 and 2021. And it should be really clear from this slide that median rent increases have far outpaced gains in median income over time. And on the right side, you see the number of cost burden renter households. That is, households paying more than 30% of their income towards rent. And in 2021, about 22 million households nationwide were cost burden, and that's essentially at an all-time high. About half of renter households, both nationally and here in Massachusetts, are cost burden. That is, paying more than 30% of their income towards rent. And we likewise have growing challenges of homelessness. This graph is based on data from the Department of Housing and Urban Development. It shows estimates of the number of people experiencing homelessness nationwide on a single night between 2007 and 2023. And what you see is that between 2007 and 2016, we actually made progress in reducing homelessness nationwide. But 2016 is a real inflection point where ever since we've had year-over-year increases in homelessness and a particularly steep jump in homelessness between 2022 and 2023. And on the national level, these increases since 2016 have been driven largely by growth in the number of people who are unsheltered. That is, folks who are living literally on the streets, in encampments, in abandoned buildings, or in their cars. It really shouldn't be a surprise here when we think about these growing trends of affordability challenges and homelessness, that these two things are related. And in fact, I've been part of a number of studies that have used data at the community level to look at community level drivers of homelessness. In one of the studies that I co-authored with my colleagues, Chris Glynn and Dennis Culhane, we looked at the relationship between community level measure of affordability, that is the ratio of median income to median rent and rates of homelessness in a community. And so what this graph shows is sort of the key finding from our study. Now on the x-axis is the median income to median rent ratio. On the y-axis is the homelessness rate in a community. And what we found is that there's an inflection point wherein when the median income to median rent ratio reaches about 32%, you see a real sharp increase in rates of homelessness in a community. So just to sum up, there's a real strong relationship between homelessness and housing affordability at the community level. And just to kind of close on my final point here, expanding our low-income housing assistance programs carries with it not only the real potential to address our growing problems of affordability and homelessness, but also to drive improvements in population health. We know that housing assistance is highly effective for helping reduce homelessness and for helping people who are of very low income afford housing. But housing assistance can also drive improvements in health by helping households access housing that's of better quality, by reducing their risk of housing instability, by reducing the cost of housing, thereby freeing up resources that can be spent on other health promoting goods and services, and by helping folks access housing that is in neighborhoods with conditions that are more conducive to good health. Unfortunately, as it currently stands, only about 1 in 4 households who are currently eligible for federal low-income housing assistance actually receive it. So while it's not the only thing that we need to do to address problems of homelessness and affordability. Probably the single best thing that we could do in the short term to address these issues would be to greatly expand our federal low-income housing assistance programs. And here, I think it's really just a matter of political will and marshaling the political will to actually fund these programs at the level that they should be funded to meet current need. So with that, I'm going to stop and hope that we can have a conversation about this, and we'll turn it back over to Karen.
Thanks so much, Tom. That was a spectacular tour de force of enormous literature in a very short amount of time. So we really appreciate that. And please make sure that you start putting your questions for Tom in the Q&A function. Our next speaker is going to be Janeska Roman. She's the Assistant Director of Advocacy and Communication at the Mass Public Health Association. She's a graduate of Boston University of Public Health and brings to her work a commitment to racial justice and systems level change through community power building and coalition building. Janeska, it's all yours.
Thank you, and thank you so much for having me. I'm Janeska, and I use she, her, and Aya, and I'm the Assistant Director of Advocacy and Communications at MPHA. MPHA is the champion for public health in the Commonwealth. We are a catalyst for community-centered change, eliminating health inequities, and promoting healthy communities for all through policy advocacy, community organizing, and coalition building. We promote state policies that advance the fundamental building blocks of good health, like clean air and safe drinking water, reliable public transportation, strong public health protections, and safe, affordable housing. And there are two fundamental commitments that guide all of our work. The first is dismantling structural racism, and the second is listening to the voices of people most impacted by health inequities and developing all of our policy priorities. So we lead with dismantling structural racism in all of our efforts, and our analysis and strategy to address structural racism forms the foundation or the framework to tackle the intersecting forms of oppression and discrimination that impact health. And the majority of our work is done in partnership, which typically follows one of three patterns. So coalition convening, which is crucial when there are key gaps in working to build upon the fundamental building blocks of good health, and MPHA is well positioned to play a leadership role. The next is capacity building, and that's when MPHA aids local groups in pursuing policy change through coaching or workshops on how to navigate the legislative process. And lastly is solidarity organizing. And I'll speak a little bit more to this later in the presentation, but that's essentially when MPHA served as an active support for coalitions anchored by grassroots leaders. So as an advocacy organization, our bread and butter is public health policy. Our focus is on state level policies and programs that prevent injury, disease, and illness, and promotes health equity among all residents. And despite our reputation for world-class healthcare, health inequities persist in our state. Report after report shows that while Massachusetts ranks high in health outcomes as compared to other states, the disaggregated data shows a completely different story, with wide disparities by region and by race. And that's because health doesn't begin or end at the doctor's office. Rather, 80 to 90% of health is created within the social and structural conditions in which people live, work, and play. And disparate health outcomes are driven by unequal access to the building blocks of good health, like safe, stable housing. And the data is clear. Stable housing is foundational to good health. When renters are evicted or pushed out of their homes, children are uprooted or pushed out of uprooted from their schools, or people have trouble holding on to their jobs and experience increased levels of toxic stress that lead to depression, anxiety, and a slew of preventable negative health issues, all of which Dr. Byrne went through very in depth in his presentation. But what's more is that the impacts of eviction and housing instability extend beyond individuals to the entire community. Evictions make it difficult for families and individuals to invest in their homes, social relationships, education, and community, which decreases opportunities for neighbors to form strong bonds, encourage civic engagement, and cultivate strong, thriving neighborhoods. And lastly, all of these factors and their impacts on health also are shaped by the historical, political, and economic context of housing in the United States. In the 1940s and 50s, federal agencies, banks, and developers implemented practices like redlining and racially restrictive covenants across the country, which prevented Black and Latina people from purchasing homes. At the same time, the federal government's efforts to subsidize home ownership for white people through policies through federally insured mortgages and the GI Bill. And although explicit racial discrimination in housing was made illegal by the Fair Housing Act of 1968, segregation is still maintained through race-neutral policies like exclusionary zoning rules, which make it impossible to construct apartments or low-cost housing in many affluent neighborhoods. Together, these policies have severely hampered the ability of people of color, particularly Black and Latina populations, to build wealth through home ownership, and restricted households of colors to neighborhoods with dangerous and deteriorating housing stock. And this history contributes to the housing inequities that we see today. In Massachusetts, Black people, and particularly Black women, are evicted at a higher rate than white people. A 2020 study by the ACLU looked at pre-pandemic data and found that Black renters are more likely to have an eviction case filed against them than white tenants, despite making up only 11% of the Commonwealth's renters. The report also found that 3 in 10 Black women had eviction cases filed against them that were dismissed, as compared to 1 in 10 white renters. So simply put, Black women were more likely to be denied housing because of a prior eviction filing, even though they won. Another analysis carried out in 2022 by the Homes for All Massachusetts Coalition and researchers at MIT found that majority Black, Indigenous, and people of color neighborhoods in Massachusetts experience vastly higher rates of eviction at the end of the state of eviction moratorium during the pandemic. The analysis found that 43% of evictions filed during the pandemic occurred in BIPOC neighborhoods, despite only 32% of the state's rental stock being located within these neighborhoods. Moreover, the study also found that neighborhoods across the Commonwealth with a larger proportion of households headed by single mothers saw higher eviction rate filings. And all these patterns are not by accident. These health inequities are not by accident. And as we think about future policy solutions, we need to look to the past to make sure that we learn from these lessons and don't duplicate these harmful policies and keep perpetuating health and racial inequities. So housing justice provides us with an alternative to the housing crisis. Housing justice is the process and outcome of establishing a housing system in which housing is a human right, and therefore everyone has access to affordable and dignified housing. And in prioritizing community rather than commodifying housing, housing justice provides a framework to assess our housing system and build alternatives where voices, needs, and the leadership of individuals and communities most impacted by health and racial inequities are at the center of decision-making. So to address our state's mounting housing crisis, MPHA is committed to promoting inclusive communities where all residents can find stable, affordable housing, and shifting decision-making power to residents who've been harmed by housing policies and practices that have been shaped by structural racism. So in solidarity with grassroots groups and community-based organizations, MPHA has endorsed the following housing justice policy slate. And together, these policies target the 4 main pathways that housing influence health outcomes. And the 4 main pathways are housing stability, housing affordability, quality housing, and then environmental and social characteristics of neighborhoods. For the sake of time, I'm going to be only focusing on 2 pieces of pending legislation that are led by our partners at Homes for All Massachusetts. However, if folks are interested in learning more about our policy slate, the public health case for housing justice, please feel free to check out our website, and I'm more than happy to send links following today's presentation. So the Homes for All Massachusetts is the statewide formation of housing justice groups working to halt displacement, increase community control of land, and win housing justice. And they're leading on 2 pieces of legislation that I'll be going deeper on: the Rent Control Enabling Act and the Foreclosure Prevention Program. So the first one, the Rent Control Enabling Act, with House Bill 2103 and Senate Bill 1299. So currently, the state is now the 5th most expensive state to rent a home, with Boston now the 2nd most expensive rental market in the country. Across the Commonwealth, rents are rising at unsustainable rates, eviction filings are reaching pre-pandemic levels, and no-fault evictions have more than doubled. And this forces way too many families to live in overcrowded conditions, drains resources from local economies, and disrupts the social fabric of neighborhoods. So HFA's Rent Control Enabling Act is a really important piece of a comprehensive approach to the affordable housing crisis by enabling local rent stabilization and tenant protections. This bill will lift the statewide ban on rent control. It'll limit rent increases to the rate of inflation, or a cap of 5%. It'll ban no-fault evictions and clarifies for tenants and landlords what qualifies as a legal reason to evict. Rent control plays a key role in mitigating the health harms of unstable housing by increasing access to affordable housing, which promotes stability, fosters stable employment, contributes to long-term family and social connections. Rent control also protects our most vulnerable households, prevents homelessness, and improves the health of communities all across the Commonwealth. Rent control benefits low-income tenants, older adults, people of color, women-headed households, persons living with disability and chronic illness, families with children, and others. And most importantly, rent control can be scaled up quickly and can provide immediate relief for families and individuals who are experiencing housing instability. So the next bill I'm going to touch on is the Foreclosure Prevention Bill, which is House Bill 942 and Senate Bill 653. So with Massachusetts foreclosures on the rise, updated state laws that better protect homeowners are long overdue. So in response to the pandemic, mortgage servicers increasingly rely on streamlined foreclosure prevention reviews that lack homeowner protections. Losing a home to foreclosure is devastating and tragic, especially when alternatives might be available but were not explored. And thousands of homeowners are now default as a result of the pandemic and are facing or will soon face foreclosure. For the first half of 2021 to the first half of 2022, foreclosures in Massachusetts increased by more than 80%. Foreclosure alternatives exist for many homeowners, whether it's loan modification, deferral of past amounts, home assistance funds, or other options. And holding conferences to review options before a foreclosure will prevent unnecessary loss of housing and costly foreclosures. So this bill will just simply require that loan servicers provide accurate loan information to homeowners and engage in prevention conferences where servicers and homeowners make a good faith effort to find reasonable alternatives to foreclosure. And lastly, every other New England state plus New York has some form of foreclosure conference or mediation, and it's time for Massachusetts to join that list. And lastly, what can you do? There are many opportunities to get involved in the fight for housing justice. If you are interested in either the rent control enabling bill, the foreclosure prevention bill, now is the time to raise our voice. The legislature started their formal session the beginning of January, and Joint Rule 10 is fast approaching on February 7th, which is the date by which all bills in each committee need to be reported out. So if you can take a moment or two to call or email your legislators and ask them to report out the bills favorably to the next committee. If you haven't done so already and you're an organization, you can follow the links on the slide to endorse the HFA Rent Control Enabling Bill or the Foreclosure Prevention Program. And lastly, to stay up to date with any action opportunities, feel free to sign up for a newsletter or to reach out directly if you have any questions about any of our housing policy slate or opportunities to get involved. So with that, I will turn it back to Karen.
Thank you so much for that, Jessica. So our third and final speaker panelist today is going to be Elizabeth Gonzalez Suarez, and she's the Vice President of Community Life for the Community Builders, a nonprofit affordable housing development company. Community Life is a place-based model that uses healthy and stable housing as a platform for connecting residents to services, resources, and opportunity. Elizabeth's work advances the powerful role that community organizations can play in providing stability and social connections. Elizabeth, all yours.
Thank you, Karen. The Community Builders is a nonprofit organization to 14,000 households in 30 cities. Our mission is to build and sustain strong communities where all people can thrive. We envision a world with vibrant, safe, and inclusive neighborhood in which all people live in healthy homes with equitable access to resources and opportunities to pursue their dreams. Today, I'm presenting what TCB is doing in the intersection of housing, homelessness, and health. Let's start with what we do. Our business is mission-driven. First, we develop healthy housing by building and preserving high-quality homes, using public financing, and employing sustainable construction practices. We have completed 33,000 homes since 1964. Second, TCB not only builds housing, TCB invests in communities by financing amenities, services, and small businesses to build neighborhoods our residents are proud to call home. As today, we have invested $240 million in new market tax credits. Third, we manage well and own responsibly. This means building apartment communities that are sustainable over the long term, physically and economically, with asset management servicing more than 150 properties. And fourth, we have community life to connect residents to services, resources, and opportunities. We are in 65 communities across 31 cities and DC. We started in Boston in 1964. Today, we have regional offices in Boston, DC, Chicago, Columbus, and New York. We are in 15 states and DC, 402 projects developed, and own and manage a portfolio of 14,000 homes. In Boston, we own and manage 1,700 homes currently. We have 430 units in construction, of which 239 are permanent supportive housing units, and we have 1,200 homes in future constructions. Now let's talk about housing for the unhoused. These two buildings in Boston are just amazing. One is in Jamaica Plain, 3368 Washington Street, and the other is in Dorchester, 900 Morrissey Boulevard. 3368 is a building with 140 supportive housing rental units for formerly chronically homeless individuals, and 62 units are for extremely low and moderate income families. 900 will have 99 homes for seniors moving out of homelessness. 3368 is starting to lease up in March, and 900 Morrissey is starting renovation in 2024. These two developments are possible because of TCB partnership with Pine Street Inn. We know that addressing homelessness is not just about buildings. It's about effectively supporting the most vulnerable with what they need. That is why TCB has partnered with Pine Street. Pine Street will provide supportive services for all the permanent housing units. Pine Street is the largest homeless services provider in New England. 900 Morrissey is showing us a cost-effective way to bring more housing for their own house by transforming existing motel rooms into new homes. It just makes sense that using existing buildings helps get people out of shelter and into housing faster. We know this is the least expensive homeless solution available today. It's cheaper and more sensible than relying on police and emergency rooms. Now let me share how we support our residents with Community Life. Community Life is a TCB place-based model that uses healthy and stable housing for connecting housing residents to community resources and opportunities. We work on the individual and community levels. We leverage local resources and opportunities to benefit our residents. We know that social isolation and social inequities makes us sick. This is why community life works to decrease isolation among our residents and creates pathways to opportunities in early education, economic mobility, youth development, community engagement, voting registration, and healthy living, and resident leadership. We also invest in eviction prevention. In fact, after the COVID-era eviction moratoriums ended, we look at our data and we saw that the households that received community life housing stabilization coaching avoided eviction. Our eviction rate is less than 1%. Lastly, I'll share with you what we are doing to ensure financial equity. In 2023, TCB brought rent reporting for credit building to all our residents. We know that the single and largest monthly payment that our residents make is rent. Yet that did not provide the benefit many of us get when we pay our mortgage or car payments on time. Today, every resident TCB who pays rent on time, which means within the month, builds credit. We only do positive reporting. Now let me share some recent data from work we did in Worcester to increase economic opportunity for our residents. We implemented the HOT Family Self-Sufficiency Program, which resulted in 85% of residents having an escrow saving account with an average of $5,000 in savings within the first 12 months. To help our working mothers, we enrolled 79% of children aged 3 to 5 in good preschool. And in the first 6 months of the rent reporting for credit building, 77% of our residents improved their credit score by an average of 26 points. These are examples of what is possible in housing to promote housing stability for today and economic mobility for tomorrow for everyone. Thank you.
Fantastic. That was really wonderful. Boy, this was just such a great start to our series to really lay out such a wonderful range of issues and the complexities that we're dealing with in this area. So I am going to kick off the questions. We've been getting quite a few wonderful questions in the Q&A. Keep putting them in there. I'll do my best to keep triaging those. I'm going to start off by asking Tom to address the issues of the trends that you see and the strategies that are in place in Massachusetts to address housing security and homelessness. If they continue with what we have now, what do you think it's going to look like in the next 1 to 2 decades, if really we stay as we are currently? Any thoughts or predictions on that?
I mean, I think, the trends both here in Massachusetts and nationally are not encouraging. We have real problems of affordability, which is contributing to problems of homelessness. So I think, there needs to be a real investment in supports for folks who are paying 50, 60, 70, 80% of their income towards rent and people who are experiencing homelessness. And I don't think, again, just to be clear, I don't think there's any silver single bullet solution. I think probably there's both demand side strategies and supply side strategies that we need to implement. The demand side strategy is kind of expanding the availability of housing subsidies is a bit easier to do in the short term. And so I think that's why, I tried to make the point that in the short term is the type of thing that we should be thinking about. But over the longer term, that's not going to be a fix-all because you still have supply side issues that we need to deal with both here locally and nationally. And that's a tougher thing to do. There are places that have radically changed their zoning codes to try and induce the creation of more dense housing. Places like Minneapolis that have essentially eliminated single family zoning, try and create more dense housing. So I think it's sort of a all hands on deck, and lots of different things are likely to be needed on both the demand and supply side.
Yeah, I think that's an excellent point, that we really are well beyond the time when we can think of a single strategy, try it, and then try something else. There needs to be a wide range of things put in place. One of the things that comes up a lot, and it's been noted in the chat, is the issue of um, uh, communities that are really not interested in having more dense housing. There's a lot of incentives for developers, for tax base, for all sorts of things, not to have more dense housing. I'd love each of you to say a few thoughts that you might have about how we can address some of that resistance to trying to take the steps to build more affordable housing, to really even densify the housing separate from affordability. Any thoughts on that? You want to kick us off on that?
No, I was gonna say I'd
Oh,
probably defer a little
definitely
bit
don't want to.
more to Elizabeth. I mean, as someone who's kind of a producer of housing might have more direct experience with that. I certainly have some thoughts about it, but are probably going to be less useful than what she might have to say.
Yeah, no, I could add that, we do definitely confront this, not in my backyard, the nimbus, and we definitely, I would say that's one of recommendation for people, for organizations that need to do this, that want to do this work and doing this work. You have to account for that year where you are going to have to meet or more with the community, with the stakeholder, with the leaders, convince them about this type of, and I specifically I'm referring to us in this case is the two buildings I share, which are the permanent supportive housing units. Those buildings encounter a lot of resistance, and we were able to navigate them, but it takes time. So you really have to account for that. I always say that we need a public health campaign in Massachusetts showing the faces of the homeless. There is just one face of the homeless that people know. And and they don't look at the homeless family. They don't look at the woman with children living in her sister home in a sofa bed that needs housing. So I think that we need, one of the things that I like to do a lot is to really humanize that own house individual, own house family. And how do we start getting the faces of all those own house people, which is not one, the most detrimental, people say the police will come, that, that is one little thing. So there's a lot of need for a big public health campaign about the true house, the true faces of their own house individuals and families. And yeah, it's hard because of that.
And the complexities, as people are noting in the chat, this is such a complex situation, and it's not just about what happens to an individual. It's all the systems that are coming together to really create the situations that that cause people to be unhoused. Elizabeth, was there anything within the two properties that you are currently developing that worked better, that was helpful in addressing the resistance? Are there particular strategies that should be lifted up more? I think the idea of a public campaign is a really excellent one, but are there other things that worked well in those activities so far?
Yeah, well, I can tell you, because I head services, I don't get directly involved. I know that we have an amazing real estate development team who brings a lot of my team members, community life, to those meetings with the community members. We have an amazing president CEO who is very invested. So you have to work at so many levels. I know that there are levels of the local, politicians, neighborhoods, and in one case we have we were sued, so we a lot of legal fees and legal fights there. But I can't provide a lot of details, Karen, because I don't get very involved with that. But I do know that it requires a team that thinks about the strategy. Our VP of communication is heavily involved. How do you go? How do you prepare, etc. So there's a lot of work.
Yeah.
Yes.
Yeah, and the relationships, I'm sure, are incredibly important.
A lot of relationships. Yes.
Yeah, yeah. Janessa, got a question for you. How do you think that we're doing in taking the knowledge that's being developed and turning it into policy that could improve the situation? Like, what are the opportunities we're missing? What are the gaps? And this is, I think, for both you and Elizabeth, how can science do a better job of helping either figure out what the questions are, answer the questions that then could really move the needle on the situation?
Thank you, Karen. That's a great question. I think to start off with the first question, I think, and kind of related to like the public education component and campaign, I think in Massachusetts with the growth of the Homes for All Massachusetts coalition and expansion across the state. I think that's been really integral in kind of combining the head and the heart argument and putting a face to the many issues that residents experience on the ground. And I think coupling stories from within the community and like connecting that with data and research is really like impactful, and it helps to kind of like put some of the faces to the numbers and humanize the data in a way that is digestible and moves our like elected officials and our state legislators along. In terms of opportunities, I think that over the past couple legislative sessions, we've made some incremental moves forward toward investing in housing and keeping folks stably housed, but we need to go much further. And I think at the state level, there's been, I would say, a little bit of a lack of political will to really be bold in enacting the policies that communities are like asking for, that communities need to remain stably housed, to remain healthy. But in terms like positively, in terms of a future opportunity that we have, on this past October, Governor Healy filed a $4 billion housing bond bill called the Affordable Homes Act, calling for significant investments in housing, as well as policies to strengthen tenant protections and provide new tools for local communities. And we're grateful that the administration proposed a lot of critically needed investments in our housing assistance programs, investments to preserve and create affordable housing, as well as to expand inclusionary zoning, and to enact local transfer option fees, and to pilot social like housing models. They're all like a great and a step in the right direction. But in addition to these goals, we have to ensure that this bond bill emerges as a really comprehensive vehicle to meet the scale of our crisis. So I think that there's an opportunity to go further and get community-led priorities included in the housing bond bill, like strengthening eviction record sealing policies so that they're automatic, providing the right to counsel, and having the inclusion of rent control policies so that families can remain stably housed in the immediate future while we scale out and build out those medium and long-term goals, like creating more affordable housing, creating and transferring power back to community through land trusts and things that take time. So we need like a both and approach, and we now have the opportunity to push the administration and the legislature to go further to ensure that the policies that are included really meet the scale of the crisis.
Thank you, Janeska. That's really helpful, and it really speaks to several comments in the Q&A about it takes such a long time to get housing built. What can we do in the meantime? And again, this need to really be looking all along the trajectory, short-term, medium, and long-term. Elizabeth, there are several questions for you. A lot of interest in your housing stabilization coaching, sort of savings account activities, and how you're addressing populations with disability. Can you speak a little bit to some of these pieces?
Yeah, I'll need a lot of more time that we have today, but I'm sure that I can share my contact information and with a following email for people to have it. But let's say, first of all, let's talk about what's most important, the housing stability piece. That's our platform. That's what we do. That's our bread and butter. That's what we wake up. And that's the main role of community life, identifying with property management. We are one team. We are communicating and identifying which are those families or those individuals who are struggling. I mean, as soon as someone starts struggling a little bit, we talk about, not only, and of course, this is the bad thing that happened after the, all that rent relief that came during the COVID time, which was so helpful. I stayed a little bit longer, and now, almost all gone. And we really need is still more rent relief because people are still struggling with that. So We are always working for looking for resources. We have grants, dollars that we do that we apply towards supporting families. But the most important is proactively, just really working very early, put them in payment plans. That rent reporting has been really amazing because they start getting something from doing that payment that within that month. And I think the most effective for us is what we call the at-risk coaching, is as soon as you get the early signs, you start working with the families. One of the positive things of low-income, affordable, restricted, housing is that you have those recertifications, those interim recertifications. People in housing know that if you have lose a job, you can, go and your rent is going to be adjusted, but those are not all the units. There are some units that even though they are affordable and low income, there are some types of units where that will not change. So we're always figuring out and prioritizing the families that are rent burden, the families that we know will struggle, and we work with them very early on. The trick here is to use data. We collect a lot of data, and that is what is help is a kind of using data to predict who is going to be as highest risk and work with them very early on.
That's great. Thank you, Elizabeth. And you're right, you would need probably a whole day to tell everybody all that you do, but this is a great start to help people understand that there are so many things to help people, even when they are housed, to stay that way. Tom, there's a question about what happened in 2016, that sort of inflection point that you showed in the rates of unhoused in 2016. What was there something in particular that happened there?
With some of the I think when you look at the numbers, one of the things that was driving big decreases in homelessness between 2007 and 2016 was declines in the number of folks who were experiencing chronic homelessness. These are people who are homeless for extended periods of time. There was a big push at the federal level to expand the availability of permanent supportive housing for folks who are chronically homeless, and we saw reductions in chronic homelessness over time, and also kind of a coincident push to reduce homelessness among veterans by expanding housing program, the VA expanding housing programs. So that was sort of a big thing that happened between about 2007 and 2016. And really kind of the drivers since then has been increases in the number of people who are unsheltered. And it's a lot of it is growth in West Coast cities, Seattle, Los Angeles, where state of California, unsheltered homelessness has increased by more than 50%. So that's sort of what's changed, is really this increase in unsheltered homelessness, and it's affecting communities basically everywhere, just on different scales. So I think that's sort of the thing that's changed. The driver of that, I don't think there's been any concrete evidence or research to look specifically at what's changed since 2016. But if you look at studies that use community level data to look at community level predictors of homelessness, kind of the clearest thing that emerges from that body of research is that it's really about housing market factors, and rent and affordability tend to be the strongest predictors of homelessness that emerge from those studies.
Thank you. Jessica, there's a question about what the response of property managers, apartment owners associations had been to the two upcoming bills that you discussed, and an argument from some that the bills may have an impact on owners' ability to maintain and manage their properties. Can you speak to that? And is there any evidence that that's the case, or how can we address that?
Yeah, I think that's a great question and often a myth. But I think before I answer that question, I want to make the distinction that the rent control bill that we are pushing is not your grandma's rent control. There's no freeze on rent. It just caps rent. So it's different than other forms of rent control like New York, where there aren't increases. So I just want to clarify that piece. But in terms of opposition, I think that there has been a lot of opposition from the big like real estate lobby and corporate developers who aren't a big fan of really like cutting down on their margins. However, like on the flip side, I would say the small landlords and like small landlord associations have been typically in support of rent control, and oftentimes small landlords are in fact like enacting like their own form of like of rent control. There's a lot of studies that have shown that small landlords already doing this with their tenants and work with them to like make sure that they can keep up with their rent payments, and it hasn't impacted their ability to keep up with the maintenance of housing, of like repairs and what have you. So I think that is often a myth, but there is now a growing body of like small landlords that have come on in support of the rent control enabling bill through HFA, and who have
Fantastic.
spoken in support of the bill.
Thank you. That's really helpful. I'm going to ask one last question to Tom, and then we'll do a quick closing and make sure we get everybody out on time. Tom, the question came in that really would enhanced federal funding for rental assistance impact rents, particularly in the low quality housing market where supply is so limited? Is there any evidence about that, and how could any impacts be mitigated?
Yeah, I mean, I think it's a fair question when you think about sort of the relatively inelastic supply of housing. So, and that's kind of the critique and the concern that's often raised when you start talking about expanding the supply of rent assistance. So I think, you know, like I said, I don't think that expanding housing subsidies is the only thing that we need to do. I do think that there are probably some things that you could do I think you could expand subsidies and think about ways to do it where it wouldn't distort the rental market so much. For example, I know HUD is really interested in instead of providing people with vouchers, essentially providing them with cash rent assistance, which they're not technically able to do just the way the regs are written. But you know, if you were to give people sort of and it's unclear to me how they distinguish this from sort of just a more general income supplement. But if you were to put more money in people's pockets, but not every dollar of it was going towards housing, that might distort the market a little bit less. So I mean, it's a fair question, and I think it just sort of underscores the point that demand side strategies are not going to be the only way to address this. We also need supply side strategies, and I think the supply side strategies are just a little bit more complicated for the reasons that we've been talking about. So again, you know, I in advocating for increasing the availability of rent subsidies, that's not to say that that's the only thing that we need to do, is I guess what I would want to emphasize.
Thank you. That's a great place for us to end today. What a fantastic session we've had today. Please join me in thanking our speakers for really a wonderful session. This was just fantastic and lays out the real complexities here, but also that there are real action steps we can take, solutions and things that can be put into place, and models that are working. So please, I hope you found this to be as interesting as I did. Stay tuned for further information about our second session in the series, which will focus on the perspectives of grassroots and community organizations who are focused on housing and health. And please do take my plea at the beginning of this session to think about what your role can be in addressing these issues, and think about how you can help with this really complex situation. Thanks so much to everybody today and to all of our panelists. Have a great rest of your day.